Guys, what do you guys know about HIV or AIDS? Do you know anybody with that disease?
Well, actually, I do. Well, he's the friend of my stepfather. He's been with AIDS for a long time, and this is the person I've known like for 14 years, and he's been having AIDS. And what I know about him is that he's been like fighting through this all his life. Even though he had cancer from his throat, he's been getting a lot of disease based on this. But he got AIDS because of his wife. And since then, he's been, fighting for this. And I've seen that he's a strong person. Like, some people, when they get sick from other things, they take it so hard, knowing that that's nothing compared of when you get AIDS, like knowing that there's no cure for that now. And knowing this person, it's like it makes me like think about it that he's suffering through a lot of things like cancer and other diseases that he has right now.
He has AIDS or he has HIV?
I think it's HIV.
I have a friend also who has HIV, and like there's a difference because if it's AIDS, it's already like terminal, or it's already more severe. When it's HIV, you can like die from a common cold. So the person I know, he was involved in a lot of like political activities with myself and my boyfriend when we were doing politics over the summer, and it's scary because he got it and he didn't know he had it until he would get routine checkups, and it doesn't show up. It shows up a little. It takes time to show, and like on rainy days, he wasn't allowed to go out because if he went out and caught a cold, that could be the end of his life. So we were like really like hovering over him and babysitting him so he would not get sick. And it's sad because you have to drink so many medications. Whether it's HIV or AIDS, you still are on medication, so your life will prolong. So
It is funny that you mentioned about that he got HIV from his wife. Last week, my wife just got her first HIV test, which is kind of scary for me just because, I do a test every year. But then again, now she tells me she never had an HIV test. And I was just like,
wow.
holy, so that tells you that, okay, fine, and she's my wife and everything, but what happens if she actually has HIV? Then I'm screwed. All my life is gone. So, that's something that should have, talk about it.
That's
And
the first thing. Like, I
Definitely.
think when you get into a relationship or something that serious, you should know like if that person got tested for this or this.
whether it's a
Especially,
relationship or a
I get
friend,
tested every 9 months, every year. I try to do it a routine checkup because you never know.
And it's free. And
And
that's
it's
the
free,
funny,
and that's the
the
thing that
funniest
it's
thing.
free.
Like I know, I'm not sure for men because men do sometimes tend not to like to go to doctors. But
Yeah.
women, on the other hand, we have to go to doctors routinely, like once a year.
Once a year.
And I know for myself, like my gynecologist always asks
Yeah, she
about the AIDS and HIV exams and like even STDs. So it's something that's always offered to you, but you decline it in a sense if you're not
Some
getting
people
it
get scared
previously.
just to know if you are or if you're not. And I
Yeah.
think it's scarier
to
to not know if you
yeah.
have it there.
And I think that's the big issue, especially like in the Spanish population, especially with guys.
The
They-
word is just stigmatized. So
Exactly.
it makes you scared.
They don't go there. And I can say when I was 14, 15, with all these tattoos and stuff.
Yeah, like shops with needles.
And some of my tattoos, like this tattoo right here, was actually done, wasn't by an expert. So you know what I mean? Like you really have to really look after yourself. And like I say, it's free. There's clinics all over New York City. You go there every year. I test myself every year because even though she's my wife, I'm sleeping with everybody else that she slept with.
Exactly.
Let's be realistic.
Yeah.
That's being realistic because you don't.
Yeah, but what do you guys do? And then do you guys test yourself every year?
I do.
Okay.
Well, I donate blood, so I get tested through donation of blood, but I also get tested through like OBGYN. So
Huh.
I always got tested because even though it's a scary thing, but I think that's one
I
of
think
the-
you don't.
That's something
once you
necessary.
have it,
you have to do it.
Once you're the one affected by it, you wouldn't.
Like to-
Personally, I wouldn't want to affect somebody else's life.
Exactly.
So if
Right.
I have it, I want it to just stay with me and die with me. Then for it
Then
to go
spread
on
it
to
out
children, like we're women, so if we have babies, we can bear children with AIDS. So
Yeah,
it's
that's
just better to be safe than sorry.
definitely. All right.
The AIDS caused my community is really serious, and because a lot of people because AIDS and died. So I hope everybody don't infect that to others. Yeah.
Okay, good.
And when it comes to HIV/AIDS in my community, I'm from the Bronx, and there's I guess you could say, there's a lot of people who use drugs and different gateway drugs and all that kind of stuff. And I know a couple of people who have HIV, and basically they're not able to live their life like a normal person. And a lot of them, a lot of people pass it on to their kids when they get pregnant because of prostitution. So the thing is that HIV is probably one of the worst things that can affect somebody, and I wouldn't wish it upon anybody. Thank you. You can come now.
My name is Kari Class, and we're talking about how AIDS affects my community. It affects very deep and very largely around my age group, around 18 and 25-year-olds. They have very raging hormones, and they don't know how to control themselves, and it makes the partner very paranoid and very untrustworthy, because you never know who has AIDS and you never know who can have AIDS, and it just makes people scared because it's a very, very dangerous disease. And I just think that if people get tested more every day, or not even every day, every 2 months, that maybe the disease could lower, or the count of AIDS could lower.
My name is Maria Corrales, and today I will be discussing how HIV and AIDS affects our communities. As we know, HIV has been very spoken within the Latino community, and there's a lot of stereotypes that HIV is highest among African American and Puerto Ricans. But what about the younger population? What about the Jews? It has been said that within the Jewish community, there has been high numbers or high number of patients who have been detected with HIV. And no, it's not the whites necessarily who are the ones who carry this really malignant disease. It's due to their husbands. It has been said that they go out in the nighttime and look for prostitutes to satisfy their sexual needs, and then they come home and give that to their wives. So therefore, that is very alarming, and we should also educate our future generations. Why? Because sadly, there's a lot of young kids who are not even teenagers yet and already have gonorrhea and some other STDs at such a young age, at the age of 12. So that's why we should educate our young children and the rest of the community to use protection, because if we don't, who knows how long we're going to live. So practice safe sex.
Hi, I'm Kasha.
Mm-hmm.
We would like to talk about AIDS and how it impacts our community.
I would say that it doesn't impact at all, because I haven't heard about it like in details, but I heard the name. That's all.
Yeah, the same thing. I heard the name only. I never met a person that's like HIV positive or anything like that. I heard the name of it, and I know what it is about, but I never met a person that was sick. And
Only thing I imagine is when I was 6, I knew that some drug addicts in our small town were sick, and that's it.
Okay.
Yeah,
so basically, we are aware of it, but
that does exist.
that exists, but we never
Met a person who
yeah,
is
met a person with it. So that's how it works.
affected.
Yeah.
Okay.